10 signs and symptoms of high cholesterol. If levels of low-density lipoproteins cholesterol are too high, or levels of high-density lipoproteins cholesterol are too low, fatty deposits build up in your blood vessels. These deposits will make it difficult for enough blood to flow through your arteries. This could cause problems throughout your body, particularly in your heart and brain, or it could be fatal. Knowing the symptoms of high cholesterol is very important for us, because it can help us in preventing the occurrence of high cholesterol, anticipate and do early treatment. People often ignore the warning signs of high cholesterol until the problem becomes severe. It is important to be aware of these signs, as addressing the problem early can save you from future complications. If you have multiple signs and symptoms of this problem, ask your doctor to check your health levels and get the best high cholesterol treatment. Here are the common signs of high cholesterol that you should know. 1. Frequent tingling. Tingling in the hands and feet is a sign of low blood circulation. This occurs when the blood flow becomes slower because of the high levels of cholesterol in the blood. Poor blood circulation causes nerves in your hands and feet not to get enough nutrients and oxygen, which gives you the tingling sensation. Tingling in the hands and feet are the implications of disfluencies blood flow in certain parts of the body. Tingling associated with nerves do not get the blood flow. This is because the blood flow becomes thick due to high levels of cholesterol in the blood. Leg cramps, numbness or spasms that hit you during the night, usually in the heel, toes or forefoot, may also indicate high cholesterol. If you hang your foot off the bed or sit up in a chair, it should start to feel better as gravity forces blood flow back into your feet. 2. Frequent headaches. Frequent headaches in the back of the head might be a result of clogged blood vessels in the area around the head. This occurs due to clogging of cholesterol plaques start forming in blood vessels. If this condition is left unchecked, the blood vessels can rupture and lead to a stroke. Headaches are most common in people with hypertension. This is a very dangerous condition because the possibility of blood pressure is very high. Blood flow that is too tight through the arteries can cause blockage of plaque leak or rupture. If it occurs in the brain, then it can cause damage to blood vessels. Headaches can also be a sign of a stroke that becomes the initial indication of a newly emerging attack. 3. Your hands and feet are always cold. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. If your extremities are getting cold for no reason, it could relate to poor blood flow. If you notice one foot or hand is cold and the other is not, it's especially important to bring it up to a doctor. Feet or legs that feel cold or are cool to the touch may be an indicator that you have peripheral arterial disease. But it's not really the best indicator. That's because this is a common problem, and it can happen to anyone as he ages, even someone without peripheral arterial disease. However, if you feel like one leg or foot is cold, but not the other, it could be time to talk to your doctor. 4. Left chest pain. Left chest pain is another sign of high cholesterol levels. Even a minimal plaque creation in any part of the body can decrease blood flow. The heart works more to restore normal blood flow, and this can cause pain or palpitation. This pain can also be a sign of a heart attack. Left chest related to the heart that acts as a blood pumping. Blockage of blood vessels around the heart can cause pain like impaled. The pain may even spread up to the neck. Chest pain can also be a sign of a heart attack. This condition can be a sign that blood cholesterol levels are too high. 5. Sore hands and feet. Blood vessels in the legs and hands also could be clogged due to the accumulation of cholesterol. This buildup generally occurs continuously and make the hands and feet sore. If you have high cholesterol, your hands and feet becomes often sore because blood vessels in your legs and hands become narrower. This accumulation generally happens continuously, and poor blood circulation and nutrient supply to the extremities make your hands and feet sore. If you experience a burning pain or feel like your legs are tired or heavy, it may indicate poor blood flow to your legs, which could be related to high cholesterol. Pain may impact one or both legs, as well as any part of the leg from the calf to your buttocks. Most of the time the pain subsides with rest but then reoccurs when you do the same level of activity again, such as walking 2 blocks. 6. Cholesterol buildup in your eyes. When your body has too much cholesterol, it can show up anywhere with arteries passing through. Your eyes are full of tiny blood vessels where high cholesterol can show up. You may notice a fatty skin deposit, xanthoma, in your cornea or yellow fat deposits around your eyelids. Xanthomas are not reserved to your eyes. They may also appear on your elbows, knees or ankles, as well as other parts of your skin. Eyelid cholesterol plaques are one of the important high cholesterol warning signs that you can find in the eyes. These plaques are yellowish in color and they usually affect upper inner eyelids but may also affect lower inner eyelids. If you see these plaques in your eyes, you need to think about high cholesterol symptoms. Eyes with grayish or yellowish ring around the outer cornea, corneal arcus, may be one of the physical signs of high cholesterol, especially if they are found in people under 40 years of age. 7. Red face. In serious cases, especially people suffering from hypertension, usually will have an impact on the enlargement of blood vessels, which conditions can cause the face of people who experience it will be red. The characteristics of this one may still be rarely known by ordinary people. You need to know people who have high cholesterol will usually experience emotional changes, such as easy to get angry when the cause is trivial. 8. High cholesterol symptoms in men. Erectile dysfunction in men caused by high cholesterol is one of the manifestations of blood vessel damage caused by high cholesterol. Your cholesterol levels can affect the quality of your erections. Most cases of erectile dysfunction, ED, are caused by impaired blood flow to the penis. The medications that treat ED, like Viagra, allow the smooth muscle cells lining the blood vessels to relax, so that blood can flow more easily. When a man has high cholesterol levels, not only is cardiac circulation impaired, blood flow throughout the body is impaired, and this can affect erection quality. In fact, many doctors consider ED to be a sort of canary in the coal mine signal in men under 40, and may suggest cardiac tests to determine if a young man with ED is at risk for, or in the early stages of cardiovascular disease. Cardiovascular disease is more treatable the earlier it's caught. 5 amazing foods to lower cholesterol you should know. A high LDL cholesterol level is medically known as hypercholesterolemia. According to the Centers for Disease Control and Prevention, CDC, over 1/3 of American adults have high levels of LDL or bad cholesterol. This increases the risk of cardiovascular disease, including heart disease and heart attacks. People of all ages, ethnicities and genders can have high cholesterol. Here are the top natural herbs to lower cholesterol. 1. Oatmeal. Having a bowl of oatmeal for breakfast daily is another easy way to lower your high cholesterol level. The high soluble fiber content in oatmeal helps lower LDL. It reduces the absorption of cholesterol into your bloodstream. Fiber also fills you up quickly and helps you avoid mindless eating. In addition, eating oats regularly is associated with a reduced risk of cardiovascular disease and type 2 diabetes. Eat a bowl of oatmeal for breakfast daily. You can also add oatmeal to smoothies or use it in baked goods. 2. Almonds. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. The heart-healthy monounsaturated fats, polyunsaturated fats and fiber in almonds help raise good HDL cholesterol and reduce the bad LDL levels. A 2011 study published in Nutrition Review found that consumption of tree nuts like almonds help reduce LDL cholesterol, a primary target for coronary disease prevention, by 3 to 19%. In addition, a 2015 study published in the Journal of American Heart Association states that daily almond consumption may be a simple dietary strategy to prevent the onset of cardiometabolic diseases. Almonds are a great snack or topping for salads, cereal and yogurt. Eat a handful of almonds a day and remember moderation is key. Other nuts and seeds such as walnuts and flax seeds are also beneficial for reducing blood cholesterol levels. 3. Orange juice. Sweet, tangy and juicy oranges are another superfood that has cholesterol-lowering properties. In a 2000 study published in the American Society for Clinical Nutrition journal, researchers found that orange juice improves blood lipid profiles in people who have hypercholesterolemia. This happens due to the presence of vitamin C, folate and flavonoids like hesperidin in oranges. Drink 2 to 3 cups of orange juice daily. Freshly extracted juice is a good option. You can also drink plant sterol fortified orange juice. Phytosterols also help lower total cholesterol to some extent. Alternatively, you can eat a few oranges daily. 4. Salmon. The omega-3 fatty acids called EPA and DHA found in salmon provide protection against high cholesterol. It helps lower triglycerides and boosts good HDL cholesterol slightly, thus lowering the risk of heart disease. In addition, salmon is low in cholesterol and saturated fat. Eat at least 2 servings of salmon each week. Baked and grilled salmon are the best options. A serving of salmon is about 2 to 3 ounces. You can even take fish oil supplements after consulting your doctor. 5. Soybeans and soy products. Soybeans and other soy products offer a complete plant-based protein that is great for those who suffer from high cholesterol. Although soy may not lower total cholesterol to a great extent, it can still lower bad LDL cholesterol. This high-protein food contains high levels of polyunsaturated fats, fiber, vitamins and minerals as well as low levels of saturated fat. A study published in 2011 in the Journal of American College of Nutrition found that eating 1 to 2 servings, 15 to 30 grams, of soy protein daily has a significant impact on serum lipoprotein risk factors for coronary heart disease. To help lower your cholesterol, include more soybean, tofu, soy flour, edamame and enriched soy milk in your diet.